For more precise and effective wearable medical devices that diagnose and treat mental disorders. Sometimes when running these webinars, I feel like I have a mental disorder. Michelle, do you want to just quickly introduce yourself and then we'll get started with the screen switch?
Yeah, absolutely. So hi, everyone. Hello, Igio. Thanks for the introduction. And I was also a part of the Founder Institute cohort with Emily and Sebastian, and it was truly a very great learning experience for me, and I learned quite a bit about my business from it as well. So without further ado, let me just switch over to my presentation.
Great. And we're going to try and get Cubby spot on if we can. My team will continue working. So we're in the awkward switching moment. I'm going to start juggling and doing other things. Now, back quickly to Deep Pixel. Lots of questions in the chat, so please take a moment, read the questions, try and answer them. Michelle, the same thing will happen with you as you go through. Hopefully we switch. There we go. And then if you have questions for Dot and Michelle, type them in the chat. She'll do her best to answer them. When you're ready, Rochelle, we'll start the timer. Everything's on screen.
All right, perfect. So hello, everyone. My name is Ishul Khan, and I'm the founder and CEO of DOT, and we have the code to decode ADHD. So we are developing a neurofeedback headset to provide quantitative analysis of brainwave activity, as well as therapy for children with attention deficiency hyperactive disorder. Out of all mental disorders, ADHD is the most common. It affects 11% of all child population, accounting to 9 million children that are affected. The annual cost per family is about $3,000, accounting to $27 billion being spent. So after surveying hundreds of families, we narrowed it down to three main problems. The current system is inefficient. Diagnosing a child with ADHD can take several years, and it's usually based on teacher feedback. Parents often have to visit multiple specialists at a great expense before receiving a confirmed diagnosis. And medication is based on trial and error, so which means it's very error-prone, as well as misdiagnosis and incorrect prescriptions are rising concerns. Our solution is efficient, affordable, and effective. Diagnosis is available to the parent within minutes. Parents can use our product from the comfort of their home. Our results are data-driven, meaning it's based on the child's EEG signals. So how do we do so? We would be selling the headset directly to the parents, who can then download the application from the App Store, which serves two main purposes: monitoring and therapy. For monitoring, we're reading the brainwave activity and applying clinically established algorithms to diagnose ADHD. Therapy is available through interactive games that use clinically established techniques of neurofeedback to help the child develop their skills. We also track the child's learning ability over time and make suggestions based on personalized data for optimal results. So if I'm to take a second and summarize all that fancy pep talk into 2 slides, this is what it would look like. We're taking the technology that exists in a clinical setting and would look so, and simply bringing it to the consumer home. We have already conducted our initial studies and tested with the Diagnostic platform. Currently, we are preparing for the crowdfunding campaign, so if you have not already done so, I would urge you to go on our website, sign up, and support the campaign, which should be up and running within a month or two. So these are the recent upcoming companies in the brain space, and the neurotech industry is truly taking its value now. And if I'm to summarize this into just the ADHD market, you'd see that there are only very few. Now, comparing these upcoming companies with the traditional ways and DOT, you will see that we have a wholesome solution to offer. I work with Dr. Rashida, who's a PhD neuroscientist at McGill University, and Nail Jazir, who's a gaming developer. We recently just graduated from the Texas Medical Center Accelerator, and we're currently raising around $1 million to be able to order the first batch of hardware, finish product development, as well as be $2 million in revenue by 2019. We're also looking to hire a marketing personnel and bring them on board. So if you're interested, please reach out to me, and I'd be happy to connect with you. My name is Ishul Khan, and we have the code to decode ADHD. Thank you.
Wow. So there's a lot of questions in the chat for you as well. The questions are flowing in. Great. So remember, ask questions in the chat. You can also take a poll. It looks like Deep Pixel came out 4 out of 5. We're going to email the presentations and the videos to everybody. CubbySpot will not be able to connect, but we'll email them. That was fantastic. I'm going to ask a question. So a lot of people say that I have ADHD now, or ADD, one or the other. I think they're being a bit of an ass, but let's say I do. Do you deal with adult populations? Because you only mentioned the children audience.
So initially, when we start off, for the first 3 years, we'll be focused on 7 to 12-year-olds. And after that, we wish to expand into the adult population. Having said that, the current platform is capable of diagnosing ADD in the adult population as well, but that's a segment that we will enter later on.
Right. So, maybe later, basically, is what you're saying for me.
It definitely will happen, though. It will be 3 years down the line.
So what about misdiagnosis? Someone was asking, and I missed the, Mel was asking, and related to that, Murray was asking, are clinical trials related or necessary, excuse me?
So initially, when we launch to the market, we're not going to be claiming diagnosis. We're going to go to the market as a monitoring device. That way, we're indicating to the parent if your kid has symptoms where they lack attention or focus, and then they can go to the doctor. Having said that, the reason why we're going down that route is not because the system's not capable. Our system, our application is capable of diagnosing, but we want to stay away from the 510K FDA approvals initially so that we can go to the market sooner and then increase our consumer database, and that way take that subset of data and enter our clinical trials and go down that route. So eventually in year 3, like I said, that's when we're going to be pivoting to our B2B model and entering clinics and physicians. That's when we will be requiring the clinical trials.
Right. And the clinical trials are expensive. So
absolutely,
you're going to do the FDA approval and the clinical trials at the same time?
Definitely. So it's going to take place. The clinical trials, actually, we have contacts at the Texas Medical Center now who are willing to hold the trials for us. So it's going to offset the cost quite a bit. And once we have those in place, we would be ready for the 510K approval, which is what we're going to aim for.
Adam was asking, is the headset proprietary?
Currently, we're developing our own headset. So yes, it will be. Right now, we're playing around with a bunch of sensors and a bunch of other headsets on the market. So there's the Muse, the Emotive, and several ones out there. We're hardware agnostic, so you could plug it in with any and every headset and it will work. But we are in talks with our manufacturer in San Diego, and we will be essentially ordering our own headset and customizing the device because we need it to be more robust. We need more sensors and make it more kid-friendly than the ones that exist on the market today.
Right. I've seen some of them. They are not kid-friendly. They are kid-anti-friendly. Like,
absolutely.
Well, I mean, they also have to work on a smaller head, to your point. Okay, so many questions. I'm going to try and burn through them. So how much is the hardware selling for? And I'll ask a related, this was Andrew, and then related, is there a license or fee for the software side?
So the hardware, we're going to sell it at a direct sales cost, so it's going to be $450, and then you get the application.
$450 US dollars?
US dollars, that's correct. And then based up thereafter, the therapy, so that's a diagnostic component. Then the therapeutic component is through gamification, and those games would be a subscription model based on a monthly fee if they want 1 game or 2 games, etc.
Okay, so so 1 game, 2 games. So it's not really based on usage or anything. It's the number of games. How many games? I'm going to just ask this. I presume someone else will. How many games do you think you're going to have in total to provide the health necessary to the children?
We're going to be focused on games that improve attention, focus, memory, and problem-solving skills. So essentially, there's going to be 4 subsets of suites of games. But having said that, we're going to try to offer the parents customized solutions based on what their child's needs are and recommend a set of games for them.
So there are 4 categories of games.
4 categories.
So you'll have at least 1 game per category, right?
That's correct.
And then you might have more games per category. Now, are you going to develop based on the needs of your population?
Definitely. That's how we're going to go down. So initially, right now, if you look at our website even, it's very kid-friendly. So now we have a cartoon image of a squirrel that's running around because we're targeting the younger population. As we go to the older population, we will have to change the game so that we can engage the adult population as well and not just be for kids.
Some of these questions are funny. David was asking, can parents or children cheat the system to get a diagnostic? I thought that was interesting, so I just throw it out there.
Well, you cannot. What's funny is there's the thresholds for, I'll get a little technical over here. You're looking at theta, beta, theta, alpha ratios, which are your EEG signals. And irrespective of how disoriented or disengaged you are, you can never hit the level of 3 unless you have some sort of mental disorder. So, and then essentially that's when you're categorized as ADD or a combination of ADD and autism and other disorders. So having to answer your question, no, you cannot really cheat the system to say that you have ADD if you don't have it.
Melissa was writing, amazing. I'm also the president for learning disabilities. So many kids in our organization could benefit from this tool. Someone was saying, hey, one of your competitor tools, the Muse, only costs $299 CAD. Do you want to just address the competitive market and the other hardware? I know you said you will interoperate with other hardware, but they're not rugged for kids and don't have enough sensors. Maybe you could comment further for Andrew.
Yeah, absolutely. So currently the Muse, they changed their focus. They were one of our, we were supposed to be collaborating with the Muse initially, but they changed their focus and now they're doing sportswear. Having said that, Muse available that is on the market is a meditation tool. It's used to just essentially, if you look at their app, it's raining and you get to essentially sit down and meditate. So they're not using any proprietary algorithms or anything of the sort to focus, improve attention or to focus. Yes, it does read EEG signals, but then with the Muse, there's also emotive, there's neurosky, there's like many on the market that already exist at a similar price point, but they're not claiming improvement in focus or attention or anything of the sort, which is where we have that edge.
Okay, and Ian was asking, will health insurance cover some of this or all of it?
So in the United States, no, it is not covered by health insurance as of yet, but we are still looking into ways where we can maybe, if not through the parents' health insurance, maybe we go through the parents' workspace and try to get some sort of those insurances to kick in and which would assist parents, help take days off, and they can use that money essentially to reimburse the cost of the headset. Because right now, because of ADD, parents actually have to take quite a bit of time off to cater to the needs of their children. And if we can get the employment insurances to kick in and assist with buying such devices, then that's going to be a plus point.
And then Serge brought up, last question, because these are really good and lots of them, that should doctors' offices actually be a potential target for you so that you channel to market and you sell to the doctor?
And that's where we would be 3 years down the line, definitely. But for that, we need to be 510K approved. We need to have the clinical trials.
Right, so you need to get the other stuff done first.
Absolutely.
Okay. All right, well, my goodness, this was a great group of founders. Wow.